So how do you fix the hump on the back of your neck? It's actually pretty easy. Let me show you how. Hey guys, it's Dr. Roberts, and today we're going to talk about a very common issue that I see in the office, and that is the hump on the back of your neck. Whether that's caused by poor posture, muscle imbalance, maybe something you were born with, we're going to dive into that right now and show you how to fix it. So where exactly is this hump forming? Normally it forms at the base of the neck. What I mean by that is you've got your cervical spine right here, the top 7 bones, and that leads into your thoracic spine. So you can see in the neck, you've got this natural curve, or should have this curve going this way. But as we get down to the thoracic area, it starts to curve the other way. And where those two spines meet, the cervical and the thoracic, that's called the CT junction. And that's typically where the hump will start to form, right at the base of the neck and the top of your shoulders. Now, why does it form there, and what's the reason behind it? Well, a lot of times patients will get this hump as a result of poor posture. So if you're sitting at a desk all day, if you're staring at a computer screen all day, and your posture gets worse and worse and worse throughout the day, and your head starts to lean forward, you can see that's going to put a lot of stress on this area right here. Fatty deposits can develop there, and just the overall structure of the spine is going to lead to that hump. Other causes of the neck hump can include osteoporosis, congenital issues, degenerative changes, but most commonly it's a postural issue, especially, like I said, people that work in front of computers all day, or even now more commonly, what are we doing all day? We're looking down at phones. So we call that tech or text neck, and that just makes the problem even worse. Some of the most common symptoms that I see with patients that have the neck hump is neck pain and headaches, obviously, reduced ranges of motion, and even dizziness. Okay, so now let's get into the real reason that you're watching this video. How do we fix this issue? Well, we're going to do 3 main things to take care of the neck hump. We're going to mobilize, we're going to stretch, and we're going to strengthen. First thing we have to do is mobilize the spine. We've got to get those joints moving, because if those joints are restricted and they're not moving properly, then nothing else is going to be effective in treating this situation. So how do we mobilize the spine? Well, if you're a patient in my office, or if your chiropractor has the type of table that looks like this is going to roll up and down your spine, mobilizing each and every segmental joint in your spine from top to bottom. So that's option number 1. However, if you don't have that option, then you can also get one of these. You can get a foam roller, and you can do this a couple of different ways. Let me show you how. So use the foam roller in the middle of your spine like this. Now you're going to want to do this on the floor. Doing this on a bed is going to be too soft, and you're not going to be able to do this on the couch. So put the foam roller in the floor, up and down your spine, and you can just roll back and forth just like this, and it's going to move your spine from left to right. Okay, in addition to laying it this way where the foam roller is going straight up and down your spine, you can also turn it sideways and lay on it just as I was before, but this time roll your back up and down. Now if you're going to do it that way, you're probably going to want to get a little bit smaller foam roller. This one's pretty large and it's not going to be as comfortable, and plus once you get up to the top, it's going to be more challenging. So if you want to do it that way, I'd recommend getting a little bit smaller foam roller, but doing it this way and going left to right will also mobilize the spine just as well. All right, and the second stretch I'm going to show you how to do is the chin tuck. It's very easy. There's a million different ways to do it, but I'm going to show you one of the easiest ways to do this. I want you to basically take your finger, stand in your normal relaxed position, and I want you to put that finger right next to your chin. Now, with your shoulders pulled back and in a nice relaxed posture, I want you to pull or tuck your chin in reverse. Basically, try to just think of it as you're pulling your chin away from the finger. So you start off like this, and then just pull your chin back. It's kind of hard to talk while I'm doing this, but you get the idea. So you're going to do those chin tucks, and I want you to hold those each time you pull that chin back for 5 to 10 seconds. I want you to do that 3 sets of 15. Now, another stretch that you're going to be able to do is the doorway stretch. So really, all you need for this is a doorway. You can do these up high and down low, and all you do is you put your arms up like this in the frame of the door, and then you just lean in to give yourself a nice stretch on the front right here. And you can also put your arms down low and do the same thing. You're going to hold this for 10 to 20 seconds, 3 sets of 15. Let me turn around and demonstrate. So the first one, we're going to go up high. I'm just going to put my arms right here, take a couple of steps back, and just lean in. Hold that for 10 seconds or so, like I said, and then repeat. Again, resting your arms on the frame of the door and just leaning in, just like that. Now that's up high. You can also do down low. If you want to do down low, you just put your hands down low, again, on the door frame and lean in. Okay, so now that we have the area stretched out and relaxed, now we need to strengthen the muscles surrounding the area. So we're going to do what's called the shoulder blade squeeze. This is a very simple exercise, but you got to do it the right way to really get the benefit from it. I want you to stand in a nice, relaxed, and loose position. And the goal here is to pretend like you've got, I've heard, a pencil, a tennis ball, some kind of tiny object, basically between your shoulder blades. And you want to try to bring or squeeze or pinch your shoulder blades back so that you're holding that object. And you're going to try to do that with your shoulder blades. Now, the way that people mess this up a lot is they pull their elbows back, or they're engaging their arms, or they try to pull their shoulders back. But you really need to put that mind muscle focus on the muscles that are by your shoulder blades and engage those first. And if you're doing it properly, if you're pulling those shoulder blades back properly, you're going to feel a little bit of a burning in that area because those are muscles that you're probably not used to using. Now, when you get those shoulder blades all the way back, I want you to hold that for about 5 to 10 seconds and then relax. And you're going to do that 3 sets of 15. All right, bonus exercise. You guys know from my previous videos that I'm a big fan of these elastic bands. So if you have these, wrap it around something so that you can do a nice row. It's very similar to the shoulder blade squeeze. This is going to give you a strengthening exercise for that same type of motion, but you're going to get the benefit of the resistance band. So again, I've got this set a little low. You'd want it a little higher, but you're just going to have your arms stretched out. Try to get this in frame. You're just going to row back. Again, the key point of this, just like the shoulder blade stretch, is you want to engage those shoulder blade muscles. You don't want this to turn into a bicep routine. You don't want this to turn into a shoulder routine where that's doing all the work. You really want to have that mind muscle focus that you're squeezing and pinching the shoulder blades together, which is causing the exercise to actually be beneficial. I'll kind of turn this way. Again, you want it to be just the shoulder blades squeezing together, 3 sets of 15. All right, so now you know how to fix the problem, but how do we prevent it from happening in the first place? Or if you already have it, how do we prevent it from getting worse? Well, in the beginning of this video, I told you that the number 1 cause of this is poor posture. So how do we prevent it? Good posture. And what I mean by that is if you're one of those people that sit at a desk all day, you're staring at a computer screen all day, your work ergonomics is going to be the number 1 priority for you guys to make sure that you're doing properly. What do I mean by that? Well, work ergonomics means basically if you're staring at a computer all day, number 1, you want your computer monitor to be at eye level and you want it to be straight ahead. You don't want to be typing on your computer and your monitor to be over here so that you're looking like this all day long. Not a good idea. The other thing is if you've got a chair that you can adjust the height of, you want to make sure that you're doing the right angle theory. What do I mean by the right angle theory? You want to make sure that the height of your chair is so that your knees are making a right angle. You're looking at it from the side. You also want to make sure that that height and your desk height level is allowing you to use your keyboard and mouse with your elbow at a right angle. You don't want your keyboard to be up too high or too low. You also want to make sure that your mouse and keyboard are comfortably close to you. You don't want to be typing out here. You don't want your mouse to be way out here. It's going to be tearing up your shoulder. So you really need to make sure that your ergonomics at work is on point. Otherwise, all this other stuff isn't going to do you much benefit. All right, and the second way that you can prevent this from happening or getting worse is if you are sitting at work all day, I want you to get up and take breaks. Walk around. Guys, sitting is the new smoking. It's the worst thing that you can do for your spine, especially if you're sitting all day and you go get in your car and you commute. When you get home, you sit on the couch. You've got to get up. You've got to move. Even if you're pretending like you're going to the bathroom, just get up and move every 15, 20, 30 minutes so that you're not sitting for hours upon hours upon hours. And the third way that you can prevent this from happening is by strengthening your core muscles. So a strong core can lead to better posture, which can prevent this from happening in the first place. So if you're doing bridges, planks, or any other type of core strengthening exercise, that's going to be your best bet to strengthen this area to prevent you from having poor posture. All right, guys, there you have it. Some very easy ways to fix the hump on the back of your neck. But just remember, consistency is key. If you're just doing these stretches and exercises every once in a while, you're probably not going to get the benefits that you're looking for. So make sure that you're hammering on this every single day. Guys, I'm going to link a couple of extra videos here, some neck stretches as well as some low back exercises that'll help you strengthen those areas, keep those areas loose. And overall health of your spine is very important when you're trying to prevent or treat these issues. So check those videos out, and we'll talk to you in the next one.